Hello, everyone. Welcome to our session, Building a Community to Address Mental Health on Campus. My name is Greg Kovich from Alcatel-Lucent Enterprise. As you know, both students and faculty are reporting record numbers of mental health incidents. Reports of anxiety, depression, substance abuse, even suicide have all reached crisis levels. Today, we'd like to discuss how universities are addressing mental health needs on campus by creating support communities and the technology used to build and bolster these communities. Joining me today is Dr. Leticia Duncan Brosnan, who is going to tell us how Alamo Colleges are using campus communities to address mental health issues to improve the quality of campus life and how technology helps empower this success. Welcome, Leticia.
Thank you, Greg. So at the Alamo Colleges, we have student advocacy centers at each one of our 5 campuses. Of course, all of the advocacy centers were supported by a charge through the chancellor, and that charge being to support equity-mindedness, to address and resource equity issues among stakeholders. And then these board policies in support of the charge are educational philosophy, student success and equity. Our student advocacy services are able to be provided through graded resources, our Alamo Colleges district, and community partnerships. We could not do this work during this time of COVID without the support of community partners, and also to pivot with the use of technology that was a key to our success. Case management is provided to each one of our students, and we are able to refer them to public, private, and community referrals. Mental health counseling, which saw a huge increase during COVID, emergency aid, federal funding, public grants, and private donors and foundation grants were able to assist us to provide funding to students. Wellness 360 clinics were established to serve all students across the 5 colleges. In partnership with the San Antonio Food Bank, we were also able to provide food services. The closed closet donations from the community and department stores were able to provide us clothes for our students and their families. This is a profile of all our students across the 5 colleges. We have an enrollment of over 68,000 students. And what we were able to do is to give you an overview of what our students look like. Our students in advocacy and across the 5 colleges are predominantly students of color, female, and predominantly part-time. For example, across the 5 colleges is 68%, and at Alamo in advocacy, 75%. To the right, you will see that across the 5 colleges, we have 2% students with disabilities, 10% veterans, and we have 17% student parents across the 5 colleges. But in advocacy services, 37% of our students are student parents. Here, we were able to provide an advocacy helpline. Through technology, we were able to work with counselors and social workers and case managers who were able to work the helpline and assist students. And as you can see, in the 2 years, we had an increase. During the outlier here is the winter emergency, which we called snowvid. We lost actually access to water and electricity for a whole week. And so we had many students calling during that semester. Due to technology, we were also able to collect information and data of all the incoming calls. And here we have a profile. The top 3 that were identified were emergency aid, health clinics, and mental health counseling. I've highlighted the mental health counseling because we continue to see an increase. As we are able to collect data from students, we're able to do an intake assessment. Here you see for the first year, it was for mental health was 45.8, 48.75, but this last year was 57%. Now, across the 5 colleges, we were able to create a mental health committee that was consisting of directors of advocacy, counselors, and social workers. And we were able to identify a gap in mental health services. We were able to hire a psychiatric nurse practitioner. that's able to support all five of the colleges with learning disability assessment and prescribing prescriptions for stress, anxiety, and depression. For many of our students, having to go and get these prescriptions is difficult for them, or because of lack of insurance, they're not able to get that access. Again, what we have found in higher education and at the advocacy services is that for many of our students who are experiencing stress, anxiety, and depression, it's closely and directly related to basic needs. Here, we were able to provide food for our students, our faculty, our staff, and also our community members in the neighborhoods that they are actually located. We were able to provide 52 pop-up markets. Individuals are able to drive through, and we fill their trunks full of food to provide food for a month. And we do this on a weekly basis. We were able to give 1.3 million pounds of food and serve a little under 26,000 individuals. We were also able to provide supplemental nutrition assistance program applications. And so this is really important. So while we provide grab and go, which is food for the day, pantry, which is food for the week, and pop-ups, which is food for a month, the SNAP applications are able to give individuals and students assistance for a year or two, which will help them get through their credential or their degree. So again, as I mentioned, we could not have been able to pivot during COVID and to provide all of these advocacy services without the use of technology. And our IT department did an amazing job. And what the first thing they did was to build the infrastructure. So bandwidth, servers, storage, software systems, right? And different solutions using technology. But what we found, especially with our students, right, there was a big digital divide. Many of our students could not afford the technology that would assist them in their learning during COVID and going remote. So our IT were able to provide internet connectivity, Wi-Fi hotspots, a loaner hardware program for laptops, and online tutoring to provide academic support, remote call centers, as I mentioned earlier, with our advocacy helpline, and a park and learn strategy, Wi-Fi in the parking lot. So students could park in our parking lots and be able to attend class or actually do their homework and connect to their faculty resource pages. For employees, also learners, we were able to provide training and tools. Now, how do we know that all of this works? As educators and researchers, we are able to provide services, but we also collect data on our services. Again, another use of our technology. And we're able to show here and demonstrate that advocacy services work. So what you see in the blue are students who receive services. In the orange, those that did not receive services. So here you see a 3-point difference in retention from within term. So that's from fall to spring semester. So here you're able to see fall to fall, which is a whole year. So we know we retain students for a semester, but now we retain them for a full year. So now they persisted, right? And so here you can see that we have a difference of almost 7 percentage points. Nationally, if you have 3 percentage points, that's considered significant. So that individuals were retained at a high rate. But here we have almost double that. Now, as we mentioned earlier in the profile, across the 5 colleges, the majority of our students are part-time. And here we have part-time persistence. Once again, we see a difference of almost 7%. And so that's huge, in regards to retention of our students.
I love this slide. This young lady here, that I think sums it up in a nutshell, that Alamo Colleges provided her with a community that she could rely on. Is there anything further? Has she graduated yet? Is she still in school?
So, this is a beautiful story, and this is why we asked Keisha if she could be our model student parent. She actually came to us during the winter weather, and she actually was one of the individuals who called the helpline. And we were able to provide food, clothes, and diapers and gift cards to assist her during that time period. She then became our admin. And when she graduated, she transferred to our local four-year university to continue her education.
What a great story. Really illustrates how these support communities that Alamo has built are providing a critical services that reduce stress, improve mental health, and empower success. I'm excited about the tech that goes into building communities like this because it really helps expand the reach and accessibility of those programs to the people that need it most. Also, it allows schools to be proactive rather than reactive, so they can reach out to students and faculty that may be in jeopardy faster and more effectively with wellness checks, alerts, nudges, and assistance before they're in crisis. As you're developing your own mental health communities, you're going to need an IT infrastructure robust enough to support these programs' reach, whether it's on campus, remote, or hybrid. I recommend that your IT foundation be one, high performance and dynamic to handle proactive technologies like nudge and location based services. Next, accessible from wherever learning is taking place. Third, easy to use for both IT staff and end users. Fourth, reliable to provide a stable infrastructure for the multitude of communities that you need to support. And last, but really not least, secure to protect the professional, personal, academic, and research information that the university has on campus. I am really happy that we had this opportunity because what we advocate here at Alcatel-Lucent Enterprise is that we can help you create these communities to connect your students with what is important to them. Thank you so much for sharing with us today.
Well, thank you, Greg, for allowing me the opportunity to share with you all of our programs.
And thank you, everyone, for being here. On behalf of Leticia and myself, thank you so very much.